I have a community leader. His name is Randy Dunn. He's been here, his family, since the 1950s. He's been on the board of the YMCA, the United Way. He's a life member of the American Cancer Society. He's a graduate at the University of Illinois. He is an incredible person, a community leader who has given so much of himself. But today he's going to talk about what he's done for himself, his health story, and I'm very proud that you're here, and I welcome you, Randy.
Well, thank you, Dr. Triana, and thank you, Todd, for helping us out here.
Certainly.
I appreciate it.
And I want to hear, Randy became a patient of the Triana Prevention Center, of mine, and my wonderful team and staff who have worked. We want to hear, Randy, tell us from the beginning your story and what was your motivation to make this change and this health change in your life.
Well, it was basically a wake-up call. I'm 60 years old plus one, but as I hit that 60 mark, I realized that things were changing for me, and I needed to be as healthy as possible. I was not paying much attention. I was just floating along and acting like I was very healthy, and I felt very good. I felt, I feel really good, and decided that I might not be as healthy as I thought when I went to my dentist, and my dentist took my blood pressure. And
oh boy.
I thought that was a little unusual. I've been going to dentists for a long time. Now, I haven't been going to doctors for a long time. The bottom line is I haven't seen a doctor since I was a child. I've worked with doctors all of my adult life, and I've avoided doctors, period. But
you said you went to the dentist.
I did go to the dentist because I absolutely believe that's the right thing to do, but I don't like to be given Novocaine, and it makes me very nervous, and it upsets me to think about him putting a needle in my mouth. So he said, you know what, we need to take your blood pressure. You look a little nervous. And I said, well, no, I am a lot nervous. And he took my blood pressure, and unfortunately he said to me, we're not going to be able to do your work today. The bottom line is you need to leave my office and get right down to the ER at the hospital because your blood pressure is high enough that you may have, in the very near future, a stroke or have a heart attack. And you need to go now.
That's scary.
That is.
Well, yes, it is scary, but I also didn't really believe him. I thought, well, your blood pressure cuff, there's something wrong with it. It's not working properly, I'm sure. So
I think that's called denial.
Yes.
yeah, well, big time denial. And my wife happens to work for a group of physicians within a block of the area that I was in. So I said, thanks a lot. I'll just run over and I'll get some of the nurses over there to take my blood pressure where my wife is. And I went over there and sat down and said, I'm not going to believe this, but I just came from the dentist and he told me my blood pressure was stroke level, and could you just take a quick blood pressure on me? So the nurse sat me down and she took my blood pressure and she looked me right straight in the eye and she said, you need to leave here now and go right straight on down to the emergency room.
Wow.
Oh my goodness.
Your blood pressure is high enough that he almost verbatim, she repeated what the dentist had just said to me within the last 30 minutes. And I thought, okay, now I'm getting a little bit nervous about this. But I'm still saying, no, this can't be right. I'm just nervous because I had to go to the dentist. I'll settle down. I'll be just fine. I'm fine. I'm healthy. No problems in the past. I'm fine now. Well, I called my good friend and business partner, Dr. Mel Katzen, and I said, you're not going to believe this, but I just had two events here. I went to the dentist. He said I've got very, very high blood pressure, and I went over here to my wife's office, and the nurse took it, and by golly, it's still high. And he said, well, what I want you to do is stop what you're doing, and I want you to go see Dr. Triana right now. And I said, you know what? I don't think I want to do that. I want to settle down. I want to relax because I know when I get over there, she's going to take my blood pressure. And I already know what she's going to say because it's already been said to me 2 or 3 times now. So I'm just going to wait until tomorrow.
Okay.
I'm going to rest tonight, and I'll go see Dr. Triana tomorrow. So that's what I did, still totally in denial. I was absolutely convinced that the next morning, that when I went in to see you, that my blood pressure would be just fine and this would all be behind me.
Right.
So I got over to Dr. Triana's office, sat down, they took my blood pressure, and guess what? It was stroke level.
Oh,
again, still.
Oh, my.
And I had done everything I could possibly do to relax, and I had no idea that I was having this sort of issue. I had noticed in the recent time some changes in how I felt. I wasn't really feeling as good as I thought I should, and I was having some problems sleeping and that sort of thing. But I thought, well, you know, I'm 61 years old, so I'm getting a little older. These things are going to happen. But I did not anticipate my blood pressure continuing to be at a level that was very dangerous to me.
It's a silent disease.
Well, it's not only a silent disease, but it's a problem of denial, or access. There are a lot of other people out there just like me who haven't taken the time to go have their blood pressure taken. I have the opportunity every day of my life to have my blood pressure taken because I've worked in medicine now for the last 35 years.
Right.
But do I take the time to do it? No. I'm worried and focused on everybody else's issues and everybody else's problems, and I just didn't take a moment of my time to even check my blood pressure. So it was a real shock to me. And if it wasn't for Dr. Triana, who took the reins, right then I gave in. I gave up. I said, okay, this is no longer, I can't deny this. This is a problem, and I've got to fix this, and I've got to figure out what on earth is going on. How did this happen to me, and what can I do to fix it? And what can I do to fix it, I mean right now.
Right.
So Dr. Triana, with her leadership, with your leadership, and I'm so very thankful for you as a person. If it weren't for you setting me down and giving me the facts and telling me straight up what I needed to do and how I needed to do it, I'd still be, I might have already stroked out or had a heart attack.
Well, that's, you know, I appreciate your thank you, and I do take care of my patients because I love my patients. I love taking care of my patients. And I noted when you came in, you were very anxious. And we did check your blood pressure. And we got you to check your numbers, your cholesterol, your blood sugar. And we gave you information on how to fix that. Do you want to talk about that also?
Well, let me just tell you, when you told me, well, we have to take blood.
Yes.
And we need to get a sample, and we need to get this taken right now, and we need to get this sent off, and we need to find out what's going on. And what I said to you, and I don't know if you remember this or not, but you probably do, I said, well, okay, I'll come back in the morning, and you can take my blood. Because now I'm just barely getting over the denial issue on the high blood pressure. Now she's wanting to stick me with the needle and draw blood. And I'm thinking, wow, if my blood pressure was high when I just sat down here, it's really going to be high here in a minute. I need to go home, relax, come back, and do this, which is what Dr. Triana agreed. Okay, that's fine. I want you to do it your way. I want you to do it the way you're comfortable, and we're not going to force anything on you. You just come back in the morning when you're ready. So that's exactly what I did, and I survived, believe it or not, getting stuck with the needle and the sample taken, and we got the information that we needed, and I was very happy as I left, and I'm sure my blood pressure came down after that, but I was very happy. But Dr. Triana had started me on some medicine even that day.
Right,
that began to help me, yes.
We started on medications to help you with your blood pressure, your cholesterol. After we received all that information, to help your sugar improve too, your blood sugar number. And I am so proud of you. The numbers, we did a advanced lipid testing, the Cleveland Heart Lab test, And I always tell people there's the red, there's the green for low risk, yellow for high risk, and red for high risk. So Randy, tell me how you felt when you saw your results.
Well, it's a good thing I was taking blood pressure medicine at that moment, because when I was presented with my Cleveland study, which is really a wonderful panel, and it's an extensive panel, goes way beyond the normal blood testing, but it gave me a snapshot of my process and my problems. Again, there's the column on the left, which is where you want to be. There's the column in the middle that says, "May you better be working a little bit to get back to that first column." But my results lined up almost perfectly in the third column at a very high risk. So I was just totally shocked. Now I realize my blood pressure is messed up, and I've got to do something about that. But now I get back all of my blood work, and I realize that in addition to high blood pressure, now I have some issues with sugar. My cholesterol was astronomical. I just, I couldn't have been any worse in terms of what I saw. And that moment that I saw where I landed on the panel, that gave me the motivation, along with Dr. Triana, who also told me about a book called The Metabolism Miracle. She said, "I want you to read this. I want you to learn about your lipids. I want you to learn about your what happens to your body and what happens to the food that you put in it, what happens when you exercise, what happens when you don't exercise." She said, "I want you to learn as much as you can." And she said to me in a very reassuring